a nursing student at Northwestern State University. I'm doing a community service project for Northwestern for my nursing 4191 class. And today we're going to talk about hand washing and the importance of hand washing. We're going to talk about how often you should wash your hands, when should you use soap and water versus using a hand sanitizer, nail hygiene, and some of the common diseases associated with the daycares. The first thing, like I said, we're going to talk about is how often you should wash your hands. The CDC, or the Centers for Disease Prevention, and as many of us know, the best way to prevent illness and infection is by hand washing. A lot of times, sometimes we get busy and we kind of say, oh, I ain't really touch nothing. I can wash my hands later, you know, I think they're pretty clean. But you would be surprised the number of germs that are on our hands just from our house, our car, you know, just the day-to-day, our shoes, just from day-to-day activities, things that we touch that we pick up germs from. So just kind of question, how often do y'all think y'all wash your hands a day? Just here at the daycare.
Oh. Let's see, when they outside, when they come in.
About 15? Okay. It's just, you know, it's just a guesstimate.
Yeah, maybe 10 of, yeah.
Okay. And I know Ms. Mims is a stickler about hand washing. But some of the most important things we need to remember is, especially whenever we get to work, we need to make sure that we're washing our hands. Like I said, when we're leaving from home, our door handles we touch, our vehicles, our steering wheels, radio, door handles in the car, the seats in the car. All those things harbor germs that we think are clean, but they're really not clean. I don't think you can really say that any area is probably just 100% free of germs. Even when you use your antibacterial wipes, like the wipes at the down, and most of them say like 99%, 99.9% kills all germs. So you still got that 0.1% that's left that, you know, may not kill some germs, okay? Before and after feeding a child, we make sure we're washing our hands. A lot of times with kids, they can be carrying the virus or have some type of illness and not be showing the signs and symptoms at the moment. And then the next day or a few hours later, they start showing signs and symptoms, and if you don't wash your hands, then you're spreading it to the next child. That's kind of how you get epidemics or outbreaks in daycares from lack of hand washing. And I know sometimes it's hard to control when you got toddlers running around, they're sharing toys, putting stuff in their mouth. You can't control everything, but if we can continue to hand wash, that helps us eliminate some of these germs that they're picking up.
I know that virus I had, Dr. Hayes said it was the type of virus that it attacked my immune system and everything about my body. It just tore it up.
Yeah, so you know,
that's true.
And also a lot of times, even with viruses with the, you know, that are known to kids or any type of disease, an adult can catch as well. So don't think that, oh, that's a kid disease, I'm not going to get that. An adult can get it too. You may not have as severe of illness from it, but you can still get the same diseases that a child gets.
Sleep.
After diaper changes or taking someone to the potty, we need to make sure we're washing our hands, especially with, you know, if you're dealing with any type of stool. Because, you know, a lot of viruses and germs harbor in stools. E. coli is one of the big bacteria that are found in stool. But there can be other type of viruses that can be transmitted from the fecal oral route that kids can get, again, adults can get as well.
You said that coli was?
E. coli is a bacteria. It's a normal bacteria that's found in poop. And sometimes in the hospital setting, if you're not careful with wiping, you can get an infection, a UTI, and you can have an infection that's related to E. coli. But like I say, it's just one of those normal bacteria that is found in stool. But we just need to make sure, you know, a lot of people, when you're not in the medical field, you really don't think about a lot of the harmful potentials from hand washing. I work in ICU, so I do see a lot of different things and stuff that you wouldn't even think of, you know, that can cause serious illnesses can. Handling the body fluids, you know, if you know, got a sick child, or just, you know, a common cold is a good example. You know, they got a runny nose. I'm just going to take Kleenex and dab. Those bugs can still get on your hands.
Right.
That's actually wash, you know. Oh, they just slide all over the place. That's wash. And I know with, you know, the smaller babies like Gavin and Lauren, You know, yeah, I mean, they're teething, so you can't, I mean, it's hard to try to, you know, just constantly wash all the time, but when you get that time, make sure you're washing your hands as much as possible. And I know sometimes it's very irritating to the skin because your hands getting all dried out, and you're like, God, my skin just, you know, all dry, but, you know, it's better for your skin to be dry than to be harboring a whole bunch of germs on your hands.
Well, is it good, can we use this in between washing, can we?
The hand sanitizer, the lotion.
The hand sanitizer.
We're gonna talk about that. One thing I want to talk about too, I know I've seen some of y'all, like when you're doing diaper changes, you're using the gloves. Make sure whenever you're using gloves, once you start using them, say you put your gloves on, you start changing the pamper, don't go and touch your cabinet after you change the pamper. Take those gloves off, because you got germs on those gloves. Yes, those gloves protect your hands, but if you change a poopy diaper and you got some poop on that glove, you go and touch your cabinet, you just contaminated that cabinet.
Ew.
So then the next person comes behind you, they touch it, they got it on their hands, and there's no telling what kind of germs.
Okay, so should we take the gloves off right after we change the diaper?
After you change the diaper, if it's a soiled diaper, if you're gonna use gloves, you take that dirty diaper off, take your gloves off, and if you want to put on a fresh pair of gloves to put on a clean diaper, do so.
Okay.
Okay?
Okay.
Or make sure that you take those gloves off before you touch that cabinet. Okay? Because we don't want to continue the passage of those germs. Okay? A lot of times we think gloves are helpful, and they are, but sometimes they're more of a hindrance than they are a help. So I know sometimes we just don't think about it, you know, and it's just second nature. We say, oh, I got gloves on. But just remember that. You know, and sometimes you don't even be thinking about it, and once you realize what you've done, just get you some cleaning solution. You know, if you're using a 1-to-1 bleach solution, or if you got something that you use in daycare, just get something, spray it down, and wipe it down. Okay. Like I said earlier, you know, your surfaces that appear to be clean are most of the time the dirtiest. You know, like your refrigerator handles. Even like the cribs for the babies. Wipe those down because they're dirty. You know, they don't appear dirty. And objects don't have to appear dirty in order to be dirty. Okay? You know, that's just like your hands. My hands are probably dirty now. Just got out of my car. And I'm sure they're dirty. But they don't look dirty, do they?
No.
They look clean. So just remember, you know, objects that you think are not dirty sometimes can be the dirtiest. I know we had a study done at the hospital. It's been a couple of months ago, or probably a year or so ago, where they came and did some swabs of some of the common items found in the hospital rooms, like your bed rail, the bedside table, and like something else they did. And then they did a sample of the bedside commode.
Ooh.
What do you think was the cleanest object out of all the stuff that they sampled?
Okay, name them again.
The commode.
The commode was the cleanest. The bedside table, the bed rail were among the nastiest things that we think are clean.
Because you constantly wiping down the commode when you feed,
Right.
but you don't think about wiping the bed rail down or the table off.
Right. So, and that's just the same for here. The things that we think are clean sometimes are the dirtiest. Okay, and it's just a wake-up call that we can be cleaner so we can keep our kids healthy. Okay. Ms. Mims asked, you know, can we use the hand sanitizer in between washing? Hand sanitizer is very good to use when you don't have a sink or you can't get to a sink. Whenever our hands are visibly soiled, so we got some dirt on them or we did get a little poop on our hands, we definitely need to wash with soap and water.
Yes.
We need to wash for at least 20 seconds. We can hum the happy birthday song 2 times around. That should give you about 20 seconds. And I know Ms. Mims does the wash your hands with the kids. You can do that. But as long as you wash it for 20 seconds. And like I said, the alcohol sanitizer should only be used if you don't have any other option. And it's good to keep with you, you know, like when you're out on the go, you know, say you shake somebody's hand and they, you know, doing this. Get some hand sanitizer, you know, sanitize your hands. Or, you know, you out in the grocery store and you touching the buggy or something. And the buggies are like a terrible place for germs. And like I say, I mean, this is stuff that we just don't think about. You know, so whenever you think about washing your hands, just take a few seconds and